Welcome to the online demonstration of breast MRI. What you should know about breast MRI. Magnetic resonance imaging, MRI, is a simple, painless examination that uses a magnetic field and radio waves to see internal organs and other soft tissue without the use of X-rays. MRI has no known side effects. MRI of the breast offers valuable information about the breast tissue that cannot be obtained by a mammogram or a breast ultrasound examination. This is because breast MRI uses intravenous or IV contrast to demonstrate blood flow to the breast tissue. MRI of the breast is not a replacement for mammograms or ultrasounds, but rather a supplemental tool for identifying abnormalities. Each exam produces hundreds of images of the breast in several different views. Recommendations for breast MRI. Breast MRI is recommended by the American Cancer Society for women with a high risk of developing breast cancer. It is also a commonly ordered exam for those women who have been recently diagnosed with breast cancer. MRI of the breast can also evaluate breast implants for possible implant rupture. If breast cancer has already been detected through mammography or breast ultrasound, MRI is useful in locating additional cancer in the breasts and determining if the cancer has spread within the breast or into the chest wall. This can be very important when preparing for surgery and trying to conserve as much of the breast as possible. If chemotherapy or other treatment is being used, MRI can help determine how well the treatment is working. MRI breast biopsy. MRI breast biopsy is used to determine whether a mass in the breast is non-cancerous, benign, or cancerous, malignant. A breast biopsy involves removing cells from the suspicious area and examining them under a microscope to determine a diagnosis. The MRI helps guide the needle to the suspicious area. The procedure only requires a local anesthetic, leaves little or no scarring, and takes less than an hour. At Valley Diagnostic Imaging Services Olympic Building, Valley radiologists offer routine breast MRI, vacuum-assisted breast MRI biopsy, and wire localization for pre-surgery breast patients. MRI biopsies are performed with the help from special computer software. The radiologist measures the position of the lesion with respect to the grid surrounding the breast and calculates the position and depth of the needle placement. After numbing the breast with local anesthetic and placing the needle, MRI imaging is performed to verify its position. Then the tissue samples are obtained. When the tissue sampling is complete, a marker clip will be placed to ensure that the site can be easily located if future surgery is needed. The entire procedure takes 45 minutes to an hour. Most patients are able to resume their usual activities later the same day. Specific instructions are given to patients after the procedure. Following the breast biopsy, a pathologist will examine the tissue specimens. The results of the specimens are available to the referring physician within a few days. Wire localization. Wire localization is sometimes ordered by a surgeon prior to a surgical biopsy. In this case, the MRI helps the radiologist guide a thin wire into the suspicious area just prior to your surgery. The surgeon then uses the wire as a guide for surgical biopsy. Preparation for your exam. Under most circumstances, no special diet, medication, or fasting is required before your MRI examination. You'll be asked to change into an examination gown. You'll also be asked to leave any jewelry, keys, and other metallic items, such as credit cards, in a locked safe. You'll be given the opportunity to use the restroom, so you'll be as comfortable as possible for the duration of the exam. What to expect during the exam. You'll be asked to relax and remain as still as possible. Breast MRI requires that you lie on your stomach for roughly 30 minutes with both breasts surrounded by a receiver device known as the breast coil. Women generally find the examination table comfortable. The scanner makes a series of thumping sounds during the examination. You'll be continuously observed by specially trained staff throughout the entire examination. The staff will communicate with you through an intercom system. Lavender and flaxseed aromatherapy eye pillows are available to aid in relaxation, and music can also be provided. The appointment usually takes 45 minutes. There are no restrictions after the exam, and you can return to your normal daily routine immediately. A very important note: you cannot undergo MRI if you have a pacemaker, inner ear implants, certain surgical clips or stents, or some other metal implants. Please notify any member of our staff or a physician if you're not sure whether you have any of the above. Please make child care arrangements or bring a family member to watch children during your MRI. Children may not be left unattended in the lobby. Breast MRI is a very specialized imaging exam. Only select radiologists have undergone extensive training and education to read breast MRI studies. The radiologists use very complex CAD software to aid in the image interpretation process. Your physician receives very detailed images and graphs, along with a written report of your breast MRI after your exam. Valley Radiologists is pleased to offer breast MRI imaging at Valley Diagnostic Imaging Services, Olympic Building, located on the Valley Medical Center campus. Please call us toll-free at 1-877-674-2674 if you have further questions or would like scheduling information. We look forward to serving you and your physician with the best in service and imaging.